Hello, I'm Ilka Bley. I'm acupuncturist, and while we're all stuck in and can't go out to see our therapists, I would like to show you and share some acupressure points which can help if you suffer from stiff neck and shoulders and headaches and difficulty turning your neck. So some of you are working more at the computers than usually. So hopefully these acupressure points and a few moments that I will show you will help. So to start with, please find a nice comfortable position and sit nicely and relaxed. And we're going to do nice 3 breaths in, just relax the body. So we're going to breathe through the nose and exhale through the mouth with a nice relaxed manner. Just breathe in and breathe out. Breathe in and breathe out. And once more, breathe in and breathe out. Okay, next thing what we're going to do, just to shrug with the shoulders, just to release those tension in those shoulders. So on a breath in, we're going to lift the shoulders up. On a breath out, we're going to relax them down, let them drop. So nice deep breath in and breathe out. Drop your shoulders. Breathe in. Lift them up as much as you can and breathe out. Drop them down. And again. And drop the shoulders down. Lovely. So now we're going to do lovely circles with the shoulders. So we're going to circle forward now. Just nice big circles. So all the way back, all the way forward. Try to get your shoulder blades to come together and all the way forward. And lovely. And now the other way, all the way up and back and down. Up and back and down. And up and back and down. Wonderful. So now we're going to do a movement with the head. So the first thing we're going to do, we're going to breathe in and then we'll breathe out and look over the shoulder just gently as much as it goes, and then we're going to breathe in and breathe out as you're moving head back to the middle, and then breathe in and breathe out and look over the other shoulder, breathe in and come back in the middle. So let's start. Nice breath in and breathe out. And breathe in and breathe out. Breathe in and breathe out and look over the shoulder. Just be gentle with yourself. Breathe in and breathe out. Come back into middle. Breathe in. Look over the shoulders gently. Breathe in. And as you breathe out, come back in the middle. And the last one. So breathe in. Look over the shoulders as you're breathing out. Breathe in. And come back in the middle, breathe out. And the last thing that we're going to do with the exercise is to move ear towards the shoulder, but make sure the shoulders are down. They are not moving with your ears. So as you breathe in, drop the shoulder down, and you can help with the other hand and keep the shoulder down, and gently, don't pull, don't lift the shoulders, and come back in the middle. Breathe in and breathe out, ear towards the shoulder. You can help a little bit of movement with the but no pulling, gently. And back in the middle, and breathe in, and again here towards the shoulder, and feel the stretch in those muscles. Feel they're getting a little bit more relaxed, a little bit longer, and come back in the middle. And the last one, breathe in and move the head ear towards the shoulder, relax the shoulder, feel gentle stretch and relax. Back in the middle. Okay, so first two acupressure points are local and they are on the base of your neck. So I'll show you. First is gallbladder 20. So just off the earlobe there is a bone, process mastoidae. So underneath the skull, from that bone, move into nice deep hollow, and this hollow is just behind this process mastoid underneath the skull, and you're moving towards your spine. So it's just there. It's between two muscles, muscle sternocleidomastoideus, and the other muscle is trapezius, and it's a lovely hollow. And the other pressure points, it's bladder 10, and if you go a little bit lower than gallbladder 20 and towards the spine, and it's in the lateral side, in the depression of that trapezius muscle, and it's tender points. Please be very gentle with yourself. Acupressure shouldn't hurt. You should really press just to the where you feel comfortable. If you feel dizzy, and stop, ease off the pressure, and try again later, but don't press too hard. Just be very, very gentle. But if you feel too much pain, it means that you're pressing too hard. You can just put your hands to that point. You don't need to even do the pressure. Just feel this hollow, and just relax your fingers if it's too tender. So first you're going to work on that gallbladder 20, and that is a really good point to ease stiffness in the neck, pain, headaches. It's used for the blood, vision, dizziness. So it is a point where head pivots as well downwards from there. So it's a good point to massage to get a little bit more extension in your neck as well, that your neck is a little bit taller, longer. Okay, and so we're going to go to do bladder 10 now, and you can use index finger. So from the gallbladder 20, just move a little bit down and towards the spine, and it's a nice depression of that just before you reach the trapezium muscle. Just massage it, just relax. Okay, next point, which is distal point, that is really good for the stiff neck and the shoulders. It's small intestine 3, and it runs along a little finger, pinky finger. So make a loose fist, and then when you come to the joint and come over the joint, just in that nice depression, it's a lovely point, small intestine 3. There you go. Just gently massage it. And same on the other side. So it is the point just of the pinky finger in when you pass the joint in a depression. That's it. And in acupuncture, we like to use the combination of the points. So this point, small intestine 3, we pair for with the bladder 62 for any problem, stiffness in the back, to open whole back. So bladder 62 you can find on your ankle. So on the outside of the lower leg, there is on the ankle joint, there is this big bone, process malleolus. Just below it, it's the point, just below it. So come back into comfortable position, and then just below that process you can massage it. Lovely. And the same on the other side. So processus malleolus, and just underneath there is the point. Oh my god, it's so tender for me on that left side. So get in a comfortable position. For me this is alright. There we go. And just press gently and massage it. Can go a little circular movement, so you can just hold it, whatever feels comfortable. Okay, and next point is on the inner side of your ankle. So you find the top prominent point of your ankle, process malleolus of that bone, and then when you come off it towards the Achilles tendon, there is a nice little depression, and this is kidney 3. And kidney 3 is as well amazing point for headaches, dizziness, insomnia as well. So nice gentle pressure. And if you want, you can try to massage both points at once, kidney 3 and bladder 62. And same on the other side. So prominent point of the ankle, and then come off towards the Achilles tendon, and it's a nice little dip, hollow, and that's the kidney 3. Lovely. Okay, so next 3 points that I'm going to do are contraindicated in pregnancy. So if you're pregnant, please stop now. So the first point that we're going to use, it's called large intestine 4, and you can find this point between first finger and the second finger. When you join them together, there is a nice bulge, and the end of the crease is that point, and it's large intestine 4. Large intestine 4, it's called joining valley, and it's amazing point for the pain anywhere in the body, for any headaches, for toothache, for swelling in the eyes, for locked jaw, for rigid spine, chills and fever. It's a point we use quite a lot in acupuncture. And same on the other side, join thumb and index finger, the bulge, the top of the crease, end of the crease, it's the point. It's a nice area to massage it. And again, don't press too hard, be gentle with yourself. And usually we pair this point with the liver 3, and liver 3 is on the foot. Liver 3 is between first toe and the second toe, and as you run between them, a nice little soft bit over the joint, There we go. And you just press here. Liver 3 is a really good point to move the energy through whole body. That energy moves freely and without stopping, that there is no blockages. So sometimes emotions can get stay in our body, and they usually rise up and stay in our shoulders, such as anger, frustration. So liver 3 is a really good point to move this kind of feelings. It's very good for any gynecological pain, and treats both cause of the problem and symptoms. So with the large intestine 4, it's 4-gate point, so opens the blood flow through whole of the body. So it's between first toe, second toe, in the middle, just past the joint, and it's just there. So again, don't press too hard. Alright, and next point that I'm going to use, the last point for today, it's the point on the top of your shoulder, on the top of your trapezius muscle. And so it's the most tender points on the crest of your trapezius muscle. So if you feel where is the most tender point, this is where you want to press gently. And as you're pressing gently, just feel relaxation coming, and just feel melting, tension melting underneath your fingers. There we go. And we can try the other side. So on the top of the trapezius muscle, on the crest, the most tender point, usually it's a midway between the spine and the top of your shoulder. So just feel, press, relax, breathe. I find this really comfortable. I can feel the muscles being so tight. Maybe try both hands together. See what works for you. Okay, and now at the end, just try to do a few more exercises with the neck and shoulders and see if you improved any movement. So let's just circle with our shoulders and feel, have we got a little bit of more movement? Are they a little bit more relaxed? Lovely. And let's do a couple of breaths and the movement of the head and looking over the shoulder. So breathe in and look over the shoulder. And breathe in and breathe out, come back. Breathe in and look over the shoulder. And breathe out and come back. And once more, breathe in. Look over the shoulder and breathe out and come back. And breathe in and look over the shoulder. Breathe out, breathe in and come back. And the last one, ear towards the shoulder, gently relax the shoulder down, stretch those muscles and back. And once more. And stretch those muscles and come back in the middle. And breathe in and breathe out. Relax the muscle down. And breathe in, back in the middle. And breathe out. And back in the middle. So thank you very much. Thank you for watching, and I hope it's going to help you to resolve your stiff neck and shoulder pain.